because we're working on strengthening the muscles, because we don't want problems to be re-injured. We don't want to re-injure it, because what happens is the muscles become weak first, and that's usually where disc problems develop after that. So we have to kind of untie it backwards, if you would. One of the things that happens is a process called muscle memory. I explained that we do applied therapeutic motion, and this is called a neuromuscular re-education, because what we have to do is teach the muscles, in addition to the discs, to hold the spine in the correct position. So we're not just addressing one aspect of it. So we use neuromuscular re-education and some very specific equipment to target the memory of those cells and erase that memory of the pain that was there and allow the cell and the whole joint to work better. And we do this through a couple of very specific machines where we're going to have you exercise totally painless range of motions, and that allows us to do what I said was neuromuscular re-education and allow those discs to actually heal. So, as I said, my main goal is to get you to return to your life. And what I'd like to do for just a moment is I'd like to turn the floor over to Ann, who's been a patient in our office. She's gone through decompression. And I know that people want to hear the information, but sometimes it's best to hear it from someone that's had a similar experience. And the fortunate thing is all I have to do is ask almost anybody that's been on this table. And even though some of them don't like speaking in front of groups, they almost always are willing to help somebody because they know where they've been themselves. So.
Well, it's real generous of him to give me a full hour to educate you on this matter.
Dinner will be delayed. Okay, your time's up. Just kidding.
Now, you know better than that. My story, I guess, is in my memory back when I was probably 5th grade or so, and they found out I had scoliosis. Well, at that time, the only thing they did for scoliosis is operate, put a rod up the back. Well, evidently mine wasn't bad enough, or my folks couldn't afford it or something, because that never happened. And as I went on through my life, and I was a beautician at one time, and that certainly didn't help my back any. And I would say in this phase of my life, I could say my life was pain. In this next phase of my life was pain. This segment of my life, it was pain. And as I got older and more things to do in life, the pain just kept coming, you know. And I'm sorry if I keep putting my back to you. I've always wanted something done for the pain. And you get to the point where you're depressed, you're in pain 24/7. No one's ever given you a resource to get out of your pain. They mask your pain with pills. They offer you surgery, which may or may not work. You know, many things. But it was probably a year or so ago, Larry and I noticed some stuff about decompression, and he suggested we look into it more. And we kind of did, but it just didn't feel right for some reason at the time. Now, my next door neighbor had similar problems to mine, and she had been having the shocks in her spine, which they may last a few weeks or a month, and then she was right back in pain and needing shots again. I thought, that's just ridiculous. I'm not going to do that. And yet I knew in some senses that there may not be relief to the degree I would like to do. Well, I'm fixing to this week, or we thought tonight, have our 5th grandchild. And I love playing with my grandkids. I'm a much better grandmother than I am a mother. And, you know, Larry and I love to get down the floor. I haven't been able to do that for a while, but I do the things that are above ground, and he does the things that are below ground. But when we saw Dr. Nannis's full-page ad in the Sunday paper a few months back, I thought, and I don't know why, his clicked, and I thought, we're going to go see this man. We're going to see what this is all about. And almost with a few treatments, and everything was so comfortable. And the office staff are so wonderful, as well as Dr. Nannis, but you just feel right at home there. But he's got very good equipment to diagnose your problem and to see if he thinks he can help you with this procedure. But the procedure is so comfortable. I beg Kim to leave me in there all the time because it just feels so good. You know? And you feel so good when you finish and all that. But it just has been wonderful to find a way to find relief and to be able to do things that I haven't been able to do in years. And I mean years. I'm not as sharp as I look, no. But I think that if you have tried some of these other solutions that haven't been solutions, I definitely encourage you to see Dr. Nannis and see if this procedure will work for you as well as it's worked for me. I've just been thankful that somebody finally found a way to help you without destroying your body in the process. Every time I would take pain pills, I'd think, what's this doing to my kidneys? You know, what's this doing to my liver? And at one time, I was taking 5 Advil at one time. 2 hours later, still in so much pain that I would take 2 or 3 more within 2 hours and never felt relief of that pain. And I've tried, you know, other prescription pain medicines that never gave me. I felt like to get an order for that medicine to give me comfort, I felt like I'd have to take so much of it, it's bound to do something inside that's not supposed to. But it is a wonderful solution. It is a wonderful thing for you to try. I don't think you'll ever regret trying it.
Thank you. Thank you.